language is an enormous barrier. And I think this is particularly true in the housing world. So housing folks speak a different language, and it's not Spanish, it's not Cantonese, it's housing language.
Yep.
And the federal and state regulatory abbreviations of everything, and it's very difficult sometimes to even start a conversation about how you can do program development across these areas. Of course, people who work in healthcare are just as guilty, but they have their own language.
We all have our jargon.
Yeah. And we think we're all speaking English, so or whatever, and thinking that we all can talk to each other, and we really can't. And as you know, I'm the CEO of an association of charitable foundations that work on aging. And that's what we found in the complex care work is that the way in which they talked about the way in which medical systems that have done most of this research talk about complex care management, and the way that foundations talk about meeting the needs of people with complex care did not mesh at all. And so we had to spend a lot of time, like, what do you exactly mean by this? And how are you defining this? And how can we find a place where we can start working together so we can learn about each other better?